Wisconsin is now on track to implement an additional provision of its BadgerCare Plus demonstration waiver. Now, you might recall that Wisconsin had asked for a Section 1115 demonstration waiver to change the way it does part of its Medicaid program, and in Wisconsin we call parts of our Medicaid program BadgerCare Plus. Now, the feds approved this on Halloween of 2018. It was scheduled to be implemented in 2019, and parts are already moving forward. We know that adding monthly premiums to our BadgerCare Plus program for adults without dependent children in the home has been approved and is on track to be started February 1st, 2020. Similarly, adding co-pays to non-emergent use of our emergency room, as well as sections of a health risk assessment and healthy behaviors incentives program, is scheduled and on track for February 1st of 2020. But there were other parts of that waiver that hadn't yet been calendared, and parts are now moving forward. Not all of them, one additional part. This is being called the SUD benefit, the substance use disorder benefit that was part of the BadgerCare Plus waiver. It would make residential substance use treatment level of care available to all BadgerCare Plus and Medicaid members. It's a huge benefit enhancement. Now, this includes coverage of treatment in what are called institutions for mental disease, or IMDs. This was part of a Forward Health update that was issued November 1st, 2019. Now, that Forward Health update didn't set the whole calendar and the whole prospect of what was to come. It gave the announcement to providers that they can now enroll in the new residential facility SUD treatment benefit. The provider enrollment in Wisconsin Medicaid is required for reimbursement of services, and providers must specifically apply for the residential facility SUD treatment category, even if they already are an existing Medicaid enrolled provider. So if you are a Medicaid provider, you're enrolled and you're qualified and credentialed to do that, you have to proactively sign up to be one of these SUD treatment category facilities. That's the announcement that went out on November 1st to providers. What didn't get announced yet, but is still to come, are things like the effective date of the benefit, the covered services, the process for getting prior authorizations, the claim submission process, and how things like reimbursement will work. Now, we are held up a little bit because Wisconsin has a new procedure that's called Joint Finance Committee Passive Review, where our Joint Finance Committee of our legislature has the opportunity to review a new timeline for implementation and object or approve that timeline. We are in that passive review period right now. If no objection happens, we anticipate that this might be one of those benefits that gets added to that February 1st, 2020 timeline for implementation, but that's not yet set in stone. Now, if you have been following this waiver quite closely, you would know that this is also the waiver that has work requirements in the Medicaid program attached to it. There is no movement on that, and we can suspect that Wisconsin might just be holding back a little on implementing that until we see what happens with litigation in other states. We will keep you posted as we learn more about the final provision of that BadgerCare Plus waiver. In the meantime, you can read in the description below what that passive review process looks like and the Forward Health memo issued to providers, encouraging them to start signing up so that they can be ready to roll when this program gets final approval.